have universal health insurance now, but we have one problem in the Chinese public hospital. It's the doctor and the patient relationship is not improving very much before this COVID-19. The reason is our public hospital actually is in name public hospital. And the funding mainly from the insurance and the out-of-pocket payment of patient. So given this incentive, the hospital could over-provide service, more tests, more surgery, more medicines, and more cost. But this, battling against the new virus, it's a social experiment. It's unexpected social experiment. Chinese government at the first time to promise free care. The insurance and the government will cover all the costs. So given this policy, we found a very unique phenomenon. It's all the doctors and the patients, they have unusual harmony relationship. They're like a family, and they work together to get against the new virus. And also, the cost to treat the COVID-19 is much lower than we expected. So on average, per person only spend 21,000 Chinese yuan. Nowadays, in Chinese hospital, I think a normal, maybe you break your bones, it will cost much more than this. And so we can see, given this free healthcare system, doctor and hospital no longer has incentive to oversupply service. Yeah. And most important is the patients, they are trusted doctors.
But Professor Li, may I remind you, the case that you just cited, which is COVID-19, is a public emergency. It is a crisis. As you may know, at the time of crisis, things are being done in a very different way, and people are interacting with one another in a very different way. So I wonder, this case is sufficient for your argument.
Actually, free healthcare is just a name. Free healthcare is based on National Health Service. National Health Service is a system. This system is based on the public hospital system. And this public hospital should be funded by the government. And the doctors are paid by the government. So the hospital and the doctor no longer has the incentive to make money from the patients. So that's called the free healthcare system. Given this system, actually, it doesn't mean you go to hospital, you pay nothing. It's just in name, it's free care. You can have co-payment. But given this incentive mechanism, the National Health Service System, so-called free healthcare, they put the doctor and the hospital in the right track.
Right.
That's most important.
Another thing people might argue, Professor Li, is we had that before, right? I mean, if you look at the planned economy China had decades ago, it's free healthcare, in real essence. But doctors and nurses are not motivated to provide services.
I should say, from this COVID-19 social experiment, we found out the problem is not a doctor. The problem is not a hospital. The problem is you give doctor and hospital what kind of incentive. Before 80s, the Chinese hospital works well. It's because the government fully funding our public hospital. From 80s to up to now, the problem is the government no longer funding the hospital. So hospital need to make money to survive. That's the problem. So the over-service actually is worse than under-provided service. And again, now actually, as we move on the healthcare reform, we do have the way to control under-provided service because we have information system. We could in time monitor the hospital doctor's behavior.
Yeah. free healthcare system is also being practiced somewhere else in the world. But some also pointed out that those systems did not work very well, particularly for a prolonged period of time. People get lazy, delay of treatment and a complicated process to get the so-called free healthcare. Professor Lee, how should we see all of these problems related to your proposal?
Yes, there are, the national health service system are the main systems in the world. Some country, this system in some country function well, some country are not.
Mm-hmm.
It's very much dependent on the governance system. So, for example, like a Hong Kong special district, like a Singapore, like a UK, actually the system functions. But especially in this battling against COVID-19, we shouldn't blame, this national health service system not functioning well. Actually, no healthcare system alone could against this pandemic.
Mm-hmm. But Professor Lee, the question really is, this year's two sessions, as you may know, is going to deal with some of these problems. We have to look at the pandemic as a reality. How can we make our public health system work with this reality of a pandemic? Will free healthcare really be the solution, Professor?
Against the pandemic, we need a good healthcare system, but we also need a functioning government system. Mm-hmm. Because this is a social movement. Quantitation, the isolation, yes, to reduce the spread of the virus is much more important than the treatment. So in the future, against this, probably, I think China need to build up a better national healthcare system. Then we can combine the public health, the CDC, with the hospital system, the health service system. So in this way, we could, more quickly respond to any changes.
Mm-hmm. There are a lot of talk about how public health now has become such a huge component, should be, of the health system. But there were also arguments put forward by, for example, retired CDC officials suggesting, some of the latest reform over the past 5 to 10 years about the medical system and the healthcare system did not necessarily help about the public health sector, and probably only weaken it by commercial incentives.
Yeah. Yes. In the past 10 years for the Chinese healthcare reform, our hospital has developed very well. It's because the market mechanism driven. But as I think this is Dr. Zheng said, the public health government are fully funded, but their salary, their fringe benefit cannot compare with the hospital's doctor. Mm-hmm. So that's why weakening the public health system. Mm-hmm. So that's why we need to treat the people. They graduate from the same medical school. You either go to CDC or you go to hospital, do the same work. Mm-hmm. They should get the similar pay. Cannot, have a huge difference. So that's why in the future, we need to combine the public health system and the public hospital, the health delivery system together.
Professor, as you may know, we have graduates coming from medical sciences universities and colleges every year, huge number. Mm-hmm. How to best use the human resources that we have right now and make sure they are in the right place, less redundancy. What do you make of that?
Yeah, this is a problem. Actually, we have approximately 1 million people graduate from medical school, especially those started MD. They only want to work in big hospital, in big city. So this time, against the COVID-19, we also found our community healthcare center, not only public health, CDC, this sector, also the community healthcare center, the local hospital. We need more qualified personnel, medical personnel. And this is the future. We need to work on it. And actually the key incentive, one is the salary, the other is the career path.
Indeed. Professor Li Ling from Peking University, a long-term researcher of China's medical insurance policy.